With both of them, there is the investment. You need to invest in a good motorcycle and good motorcycling gear. Though there are risks, you have to take calculated risks, and safety comes first.
Well, I'm here with the renowned Dr. Sri Ganesh, founder of Nethradhama Eye Hospitals. Sri is an aficionado of motorcycling, refractive surgery. He's a real renaissance man, and I have the pleasure of talking to him today. So Sri, tell me a little bit about what's going on in your life these days. Motorcycling, that sounds very exciting.
That's my passion, and I used to ride motorcycles when I was a teenager. And once I got into medicine, it became so busy and there was no time. I think from the past 15 years, I kind of realized that I need to get back into my hobbies. So I purchased a motorcycle, started riding, and I've done quite a few tours in India, and then I did the Alps also in Europe, 5 countries, South America, Patagonia, South Africa too. So quite a few. I just completed a tour of Morocco, and that was amazing.
And you yourself, having been a patient of refractive surgery, I imagine you've been quite pleased with the results, especially given your adventure motorcycling.
Yes, in fact, I'm writing a paper on presbyon in motorcycle riders, because many of the middle-aged riders, they wear glasses, presbyopic glasses, and then it's very difficult to ride in the rain or at night. So right now I've treated about 15 of my riders, and they're very happy. So I'm planning to publish a paper on that, because it's a different kind of requirement. These riders need very good distance vision. They should also look at the speedometer, the Google Maps, and all kinds of lighting. So that's very interesting.
Interesting talking about motorcycling, because there is a pursuit in that as well. Do you see some parallels between your motorcycling and your excellence in refractive work?
With both of them, there is the investment. You need to invest in a good motorcycle and good motorcycling gear. There are also safety concerns. Though there are risks, you have to take calculated risks, and safety comes first. So there are a few similarities.
Sri, also when it comes to the founding of your centers, you mentioned there are 10 such hospitals now. How did you do it? How did you have the gumption to back in the day do this?
Well, I started in 1994, and I started my practice because I couldn't land a decent job that paid well. So I started in a very small clinic. It was like a 10 by 10 room. I bought my first laser, which was the most expensive laser on the market. I think it was about $450,000 because I wanted to give the best results to my patients. And this has been my goal in the practice, excellence, and to give the best outcomes to my patients. And this is what has helped the practice grow. I have now the second generation, third generation coming in. It's been 32 years in the practice, and my kids have joined me now in the practice. You need to kind of cultivate the culture of excellence. So this is my tagline, that technology is our tradition and quality is our culture.
You are a renowned refractive surgeon, and so I'm quite curious, what are you using in the refractive surgery frontier nowadays?
Right now, I'm doing a lot of Smile Pro with the VisuMax 800. I also helped develop the VisuMax 800 with Zeiss from 2015. And now they've introduced hyperopia. I was also involved in the global trials for hyperopia, but now we are doing hyperopia on the VisuMax 800. We also have a Zimmer Z8 Neo, but this is a mobile unit which we actually use to cater to our peripheral units, because it can also do cataract, it does refractive, cornea work. And then we also have 3 Schwinn lasers, excimer lasers, where we do a lot of trans-PRK. We have the MRS 500 and 750. We have 3 of those, and they are basically in our other centers. The advantage of trans-PRK is it doesn't need a very high degree of skill, so it's fairly safe. And in the main center, we have a MEL 90. We mainly use it for presbyon. In fact, I got my presbyon done 10 years ago, and I'm still perfect without glasses.
Ah, fantastic to hear. So when you're passing on advice to the next generation, could you talk a little bit about their education?
I've been running a fellowship program from '99, so almost 27 years. And more than 300 fellows have been trained in our institution, and a lot of short-term fellows. I always believe in passing on my skills and expertise. And some of the fellows who have trained with me are doing very well in practice. So it's very fulfilling when you see the next generation coming up and you're able to kind of mold them and then mentor them.
Also, in terms of charitable contribution, tell me about that.
So we have two charitable hospitals called Shraddha Eye Care Trust, and we do about 10,000 free cataract surgeries every year. And we have very good equipment there. We have phaco machines, we have good microscopes. And this is an established training program. We also offered short-term training, and we also have some courses. Recently, we had the London Vision course for the first time in India, and we have also teamed up with a few of the industry leaders. We have a program with Zeiss, refractive surgery training. We have a program with Rayner for phaco training now. And because of our charitable work, it also supports our fellowship program. So the fellows get to do about 200 surgeries, so they become very skilled.
You know, looking over the course of your life, Sri, you've had success in the commercial arena, you've advanced charitable initiatives, you're also delving into your own passions for motorcycling. How would you kind of rank those as far as your satisfaction nowadays so that the next generation knows what to focus on?
I think it's very important to have a good work-life balance and family. I think one of the biggest blessings you can have is to have a good partner in life, and my wife has been very supportive, and I'm blessed to have good kids who want to follow my path. Of course, you also have to look at your personal hobbies and give time for your hobbies so that mentally you're always fresh, and you need to take care of your physique also. So exercising also is a very important aspect. Life is a balance of all these things, and you can do everything if you are able to manage your time.
Well, thank you, Sri, for all the nuggets of wisdom here today. I'm so glad to see you spearheading these different areas of your life, both for yourself and your community. So thanks for joining us.
Thank you so much.